So good morning, everybody. We're going to look at the health and social care sector unit again today. Over the previous sessions, we've looked at learning outcome 1, which was understand the organizational structure of the health and social care sector. And then in the subsequent session, we looked at investigate current legislation and professional codes of practice and how they impact on health and social care provisions. So that was learning outcome 2, which was yesterday's session. And then today, we're going on to our last learning outcome, which is learning outcome 3. So understand the importance of multidisciplinary working in health and social care. So this is all about working together, partnership working, how different organizations, different services actually work together to try and provide the best for the service users. So there's a number of assessment criteria in here. There are 3 assessment criteria for the pass criteria. So there's 3.1, explain the benefits of challenges of working in partnership with others in the health and social care sector. Then we'll look at 3.2, explain how the health and social care sector work together. 3.3, describe examples of best practice in health and social care services setting. Then we've got our merit question, which is explain the role of learning and development in promoting multidisciplinary work in the health and social care sector. That's all about your training and your development. And then 3D1, assess the potential consequences of health and social care services not working in partnerships. So you'd look at things like the barriers and how that might stop good partnership working and what it might lead down to. So, Rachel, can you see my screen as well? I'm sorry, I didn't ask you earlier. I'm going to take that as a yes until she tells me no. So again, we scroll down to the indicative content. So this section, this large section here is for learning outcome 1. Then we've got a little smaller one here for learning outcome 2. And then learning outcome 3, it just lets you know what sort of points we'd want to have introduced within the assignment once you get down to it. But we'll have a quick peek at this towards the end of the session. Just make this larger. So the health and social care sector, learning outcome 3, understand the importance of multidisciplinary working in health and social care. So over the next few slides, before we start on the actual assessment criteria, we're just going to be looking at what partnership working is and how it's come about. So partnership working has been a recurring topic in the public policy for about 40 years now. So there's been many variants of different partnerships, but one of those that have come about is like a single system of partnership working. So what they're trying to do is have a full integration of everybody working in partnership together. So partnership working can come about because of underlying issues within the current welfare system. Obviously, people were slipping through the system, they're not getting seen, or if they're moving areas, they've gone out of the local authority into another one. There's no cohesive care being done. So there was a need to have different departments of these two. There was a need between the needs of those who were sick and needed health care and those who were disabled and they had social needs. So on this, it just wasn't really working at that time, which is why partnership working has come into effect. So to try and get those needs catered towards. So I'm going to just go through this last point here. So the developments in partnership working began in 1997. So this was during Tony Blair's Labour leadership. And what he promised was that there was going to be a rebuilding of the NHS. They're going to have increased spending on patient care, and they're going to promise a stronger community where they'd have a good foundation for a better welfare state and community care. So it sort of began developing around that time where partnership working was coming into strong effect. So this actually focused on the partnership working between the health and social care sectors and also the service users. So there was this document called the White Paper document, and it's got over here, Shifting the Balance of Power Within the NHS. Now this was created by the Department of Health in 2001. So this came about as part of a new strategy which was implemented, but to be honest, it's focused more on healthcare than social care. So there were issues within this as well. There's a strong emphasis on joint working within here. So there's something called, if you see here, it was introduced, the Health Improvement Modernization Plan, so HIMP. So on here, what it says is that each health authority is obliged to produce a HIMP. So Health Improvement Modernization Plan is to set out a strategic framework for improving health. So this modernization also needs to be applied to how services are planned with their key partners like local authorities and voluntary organizations. So in a nutshell, each authority needs to create one of these plans, and they need to work out how they're actually going to be working together and who has what responsibility. So we're going to look a little bit more at partnership working. So partnership working is done across health and social care, and it's actually the heart of how care is delivered. It's trying to create a seamless care system and to avoid fragmentation. So when I say fragmentation, I mean like avoid it being distorted or broken up or with people falling out of the system. They're trying to make it seamless so that everybody under their care can actually get looked after. So there's actually been a major shift towards the outcomes of the service, and this was addressed in the new outcomes framework for performance of assessment of adult social care. Now, it came about with these 3 points. So it says, so outcomes for professionals. So professionals involved in partnership working report that they enjoy it and they find it rewarding and stimulating. For those involved in developing new working approaches, there is the element of job satisfaction from creativity and autonomy from the experience. And then 2 studies that explored partnership working within the context of health and social care, they reported gains in confidence among professionals, improved relationships with other professionals, and improved relationships with families. So in a nutshell, these 3 points, what they're pointing out is that they've spoken to professionals that are working in healthcare at the moment, and they've reported that there's benefits within this, that they're enjoying it, they like having the creativity, they like having the responsibility of developing new things, and that they're actually improving with their own confidence, and they're gaining a lot of information. So even though there's partnership working, there can actually be negative effects to this. Some of these can be like there's a confusion about your role. Now, if you think about it, if you've been working in a particular role for many years, if you've been in a care home for many years, and you know that now you're going to be liaising with the NHS community nurses, then it can become problematic. Then you might start questioning, what's my role then? What am I going to do if I'm the one delivering this care to these patients, but these community nurses are coming in? What are they doing and what am I doing? So it can be quite confusing for the staff members within the agency at that time about what am I supposed to do? what's my new role within this new partnership. Good morning, Stephanie. So Stephanie's just joined us. I'm not sure if she can hear me. Yep. So there are a couple of outcomes for the good outcomes for the service users actually on here. So what the service users were saying is that they found that the services towards the patients and the clients is actually become better. So because they're delivering joint services, people are being able to be seen a lot quicker. There's a lot more preventative and early intervention that's been focused on. So you're looking at things that are, going to be nipped in the bud or looked at a lot quicker. So obviously this is not just to do with health, but it's also to do with their social care as well. And then there's a lot more access to these services than there was before. So obviously in layman's terms, that'll mean that you'll be able to see a professional person much quicker than you might have done in any other aspect. Hi, Stephanie. Do you have audio now? But I think she's having some problems because she's dropped back out again. Yeah. So there's actually a stigma that's attached to these services. So there can be a positive impact on professional identities within multidisciplinary work. So obviously with multidisciplinary, we're talking about partnership working. It just shows that social care individuals and health care individuals, they're just feeling that they're more accountable towards their role, and they can actually say, I'm going to do this and it will get done. So if they've said that a particular thing will be done, like we're going to have a case review for X, Y, and Z, they're actually making sure that with their joint collective, these items are actually getting done. They're not getting pushed to the back burner. So it's becoming a positive thing in this way. But again, there are barriers as well. So we're going to look at some barriers towards partnership working. So in partnership working, there's actually a major barrier where a lot of the health professionals and care professionals feel that there's not any mutual respect between the agencies. So it's not a case where everybody is feeling the same, but it's within some cases. So, for example, if there's a health professional that's gone into a care home and they've said you need to make sure that the basic care needs of your elderly patients are being met and so on, the care home might not feel like, they might say that, why are you telling us? This is our daily job. We know what we're doing. But unfortunately, in some instances and in some care homes and in some agencies, this type of reminder needs to be given. There's also an issue where some people may think that if they work within the NHS that they've got a higher power dynamic, so that they feel that they're more professional, they're more powerful, they've got a higher status than care staff. So that can actually impact on the equality of partnership working as well. Hi, Stephanie, you've joined back in. Have you got audio now? Sorry, if you excuse me for 1 minute. Okay, so we'll go on to slide 8 now. So we're just going to look at a couple of points on here. So it's still all about partnership working, about what we're doing. So within partnership working, it's a common practice that education, training, development is actually being shared within the agencies, within the partnerships. So they might not be able, so they're able to improve their own development. I'm sorry, ladies. Stephanie's having a little bit of trouble. I'm just going to see if I can give her a hand. Right, thank you for bearing with me. So, as I was saying, education, training, and workforce development is a very important thing that is actually coming out of partnership working. There's a lot of interaction between different agencies as well, so that when you're talking to somebody who, say for example, if you're a nurse and you're a surgical nurse, you might be speaking to a community nurse who may not know what a particular jargon is, or a particular acronym is. So just try and keep your language as clear and simple to make sure that everybody actually understands. So we're going to go on to 3.1. So ladies, are you okay so far with what we've been doing?
Yeah, sure. On my side.
Mm-hmm.
Thank you.
Fantastic. Brilliant. So in this section is explain the benefits and challenges of working in partnership with others in health and social care sectors. So on here, we're going to look at the benefits first, and then we'll pop down and look at the challenges on here. Hi, Stephanie. Do you have audio now?
Yes, I do, but I don't know what's happening to my laptop.
Yeah, it can. Mine does the same as well. Sometimes the microphones don't work. So later on, just try turning it off and turning it back on, and it should work. Now, you've got an echo. So what you need to do is, do you know on the mic where you can see my arrow, the very first mic thing, just click it and turn that section off. Fantastic.
Okay.
So just click it and then just turn it so it goes from orange to red, yeah?
Is it still echoing?
It is, yes. You just need to, not on your phone, you need to do it on your laptop. So on the top where it's got the join me bar,
the
very first orange button, just click it and it'll say mute yourself, and it should go from orange to red. You can still talk to me, but it will be through your phone, not the computer.
I did it, but don't let me log off and come back in. Sorry.
Don't. Yeah, no, that's okay. No, see what happens. Yeah, that should help, hopefully. So, thank you. So, like I said, we're going to be looking at the challenges and the benefits on this. So, we've got a couple of things on here, and I'm going to ask you a question in a second. So, we've got continuity of care. So, it's just making sure that the quality of care is given in a good way over time. Then we've got holistic care. Does anybody know what holistic means?
Yes. This is the like the sum total. It involves your psychological care, your physical care, even up to family care.
Yes. Well done. That's perfectly right. So it's all about everything to do with you. So like Charity just said, it's your family care, your psychological, your social needs, your mental development, your health care. So everything to do with your care and your lifestyle, that is what holistic care is. So if I'll read a little bit off here. So holistic care is about treating the whole person. So you're not just looking at a person's illness or the conditions, and you're not trying to treat them separately. You're just looking at it in total as an overview. So holistic care is actually quite a big thing within education, within health and social care. It's something that has come about, which is a fantastic thing to do, because you don't just focus on one thing. You're trying to see what their environment is, what their home communities are, and how much care they actually have. So it's always a good thing to say. You can't just send off a patient and say, here you go, you've got your bandages, go and see if you can do this. You've got to be able to know, are they capable or are they able to do this for themselves? And then we've got effective and efficient use of resources. So within the multidisciplinary working objectives, what they're trying to do is not just work together and show that we're providing care for others. What they're doing is they're trying to minimize cutting down on appointments, and they're just actually making sure that, say, if they have an appointment with one professional, it's not getting doubled or tripled with the other people as well. So their goal is to be more efficient and to use their resources in a timely and good manner. And then we have challenges. So there's a few challenges that can come about with working together. So it can be things to do with finance. So have you got enough money to be able to run your business if you're in a care home? Have you got enough finances to be able to send out your staff to appointments or get this care given? And then you've got communication. So we need to have, good communication skills. So if you've been with us for a while, we did that communication unit on how important communication is. For some of you, we will be going on to that soon. So it's just things like be able to speak clearly with families and with the patients, to make sure that you're not using jargon and that you're actually helping them feel at ease. And then we've got something called local and national differences. Now, these differences, in a nutshell, all it means is that local authorities or local healthcare is restricted to one area. So if you're within the Greater Manchester area, that's where your circle of care is. So that's where you can deliver your care. So if that person moves out of that area, you physically can't deliver care to them within your authority. But national is actually, they've got the whole of England. So they can, no matter where that patient moves or where they've gone, they can go wherever they can continue their care on. So if you're in local, you got the issue of maybe if you've developed a good relationship with them, they might fall through the gap. They might leave your care and having to restart over with. But with national, you can have that care being continued on. And then on to 3.2. Are we okay so far with the benefits and challenges that you can see for 3.1?
For me, sure. The only question I have,
yeah,
I will ask at the end, please.
Okay, no, that's fine. No worries.
Yeah, on the barrier.
Oh yes, we're going to be looking at barriers again soon as well, so it might even get answered soon. Yeah. So So in 3.2, we're going to explain how the health and social care sector work together. Now, on the following slides, we'll actually look at aspects of partnership working again, which we've been looking at throughout this session. So health and social care bring separate organizations together, and they show how they share their expertise, their resources, and how they do power sharing within each other. So partnership working can be formed between individuals, agencies, or organizations who all have like a shared interest within a particular topic. So these partnerships are normally coming about because of a specific objective. So, for example, if there's a care home that wants to maybe alleviate loneliness within the elderly carers or make sure that they're getting more visitors, they might partner up with a local school where the pupils are coming in and they're doing story time or they're doing activities together. So these partnerships, they can be done to, obviously, like we said, about specific issues, but they can be short-term or long-term, or they can just be rolling year by year and just see how it goes until it's beneficial for either of them. And then we've just got a little thing about what multidisciplinary teams are. So I'm just going to read through here and just give you the succinct answer of what multidisciplinary teams actually do. So a multidisciplinary is a government initiative to encourage cross-professional boundaries and support organizations to work together as one workforce. So obviously different organizations, different authorities, like maybe the police and the schools and health and social care settings to work together. So professionals are being encouraged to recognize the benefits of working in partnership in order to provide a more consistent service for individuals. So the MDT, multidisciplinary team meeting, is done on a monthly basis, and it brings together staff with necessary knowledge, skills and experience to ensure high services are delivered to the patients. So overall, all it's saying is that multidisciplinary teams are formed together to be able to share their own experiences and expertise, share their knowledge, and just to bring better service for the service users. And then we've got a couple of legislations which we've come across a few times. So we've got the Health and Social Care Act of 2012, Working Together to Safeguard Children, the Care Act of 2014, NHS Act of 2006, and the Local Government and Public Involvement in Health Act of 2007. And then we go on to 3.3. So describe examples of best practice of health and social care services working together. So what we've got over here is, excuse me, it's just how different services are actually going to work together. So it's just like the community health, mental health team and what they do. So they support people living in the community who have complicated or serious mental health problems. Stephanie, can I ask you to mute yourself, please? Is that okay? Thank you. So we've got a multidisciplinary assessment. So what they do is they give treatment to people from 16 years and above. So normally it's 16 to 70. And these are individuals that might have been diagnosed with a mental health problem. So normally it's the community mental health team that will support them, unless it's an adult and it'll be just the adult version or the younger person version. So these community health teams, they're actually there to care for people who are suffering from mental illnesses, things like schizophrenia or severe disorders or personality disorders. There are a couple other areas that they do cover. So it could be for people who are on the autistic spectrum, people who actually need a little bit more stability, info within their own lives. So they've got substantial disabilities as a result of their illnesses. They're not able to care for themselves independently, and they can't either keep up a relationship or employment. So this is what the community health, mental health team try to focus on. So what they provide is outpatient services. It's a specialized outpatient service for children and elderly and individuals who are chronically mentally ill. And these are the residents of the CMACs. So they're either been discharged from their whatever setting that they were in before, so they've come under the care of the community health, mental health team. So all it is for 3.3, you're just talking about how different examples of best working practice. Now, another example of this that could actually be where, because in assignment day, which we'll talk about on Thursday, all it is that you're talking about how different organizations or how different services are working together. So what you would do is, so for example, if there's a person that has gone into to the GP and they've said that they're not feeling well, the GP has referred them to the A&E maybe, and they've gone and they've had scans done, they've had tests done, they've gone up into the ward where they've realized that maybe this person is actually suffering from cancer. So this person would then go down to the surgical care team. If they've had to have an operation or chemotherapy, then if they've been discharged to being home, they've got community health nurses coming to visit them. So all you're doing is you're talking about the different services that actually work together to support that one patient. Hi, good morning, Joe. Can you hear me?
Yeah, good morning.
Morning. Fantastic. And can you see my screen?
Yeah.
Fantastic. So we're almost towards the end now, but you've caught us at, we're on to our merit question now, so you've caught us just in time.
Okay, that's fine.
So for the merit question, before I go on to this, does anybody have any questions about what we've covered so far? That's all right. I'll carry on then. So on here, we're going to be looking at the role of learning and development in promoting multidisciplinary work in health and social care sector. So this is quite similar to what we were looking at for CPD, so continuous professional development. But it's just about how you learn and develop within the workplace on a day-to-day basis. So the best way to promote MDTs, so multidisciplinary teams, is to be educated and mentored by the workers. So you either have study long courses or professional courses, and all of this is just to develop your own professional skills. So the best way that this is actually done within different services, within different departments, is that if you're just sort of like shadowing somebody or you're working with them, so all you're doing is you're shadowing someone, you're working with them, you're seeing what other people are actually doing. Let me just, sorry, if you excuse me for a moment. So I was just muting the background noise so we don't. There you go, I'm back to where I need to be. So like I was saying, it's just that you're learning, you're developing, you're trying to figure out how to do problem solving, and then you're just working together to share your own knowledge. So this can be done through something called mentoring. So it's a long-term process, so it's based on mutual trust and respect. So mentoring is a long process. Meanwhile, coaching is a short process. So when you're being mentored by someone, you might have something that you're on a 6 months to a year course, and they're actually just helping you develop through, or they're guiding you through that course. When coaching is just something, it might be an informal chat, or it might just be that you're getting assessed or you're getting reviewed, and you're just getting told, right, this is how to do this procedure, just make sure you do this, that, and that. So that's the difference between mentoring and coaching. So mentoring is actually put into a lot of use for health and social care. So it helps to support the career development of minority groups, and it encourages the development of a team. So sometimes what happens is that you become stuck in a team or a relationship within a team where you're not really learning off each other. So when you're getting intervened with, or you're getting interventions from other organizations, or you're getting somebody else coming in from outside, you're able to learn new skills. So another way that we can promote multidisciplinary work is just, obviously, like we just said, so just continuous learning and development. You learn more skills, you get more knowledge, and you're just able to share what you know with each other when you're working with other people outside of your own department or out of your own area. So the roles in promoting multidisciplinary work. So what you do is you help to provide training. So it increases your knowledge and your skills. You get opportunities, so you can get you can do joint training, you can share ideas, you can give opinions to each other, and you can even ask questions without even feeling silly, because sometimes it'll be that you might be wondering about something, and then everybody else might be doing the same, but they're not all asking. So you just ask away, and you get the answer to what you want, because there'll be such a wide array of people there. The way of promoting multidisciplinary work also is that you get a strong leader, so they've actually got a set of specific goals, and they know how to reach it, and they know how to go towards it, and that'll actually help you as well, because you'll be able to focus on what you want to do. So all of this, the roles in promoting multidisciplinary work, it was set out in the Health and Social Care, so the Safety and Quality Act of 2015. So it's aimed to reduce anxiety about data sharing. So the best practice within this means that any interested participants can actually be involved in learning and sharing their best practices. So it's always good to just share them internally, just find out what sort of things you may want more experience on, and then just getting a member of staff that you think knows a little bit more than yourselves or can help you, and just learning off each other. So 3M1 was just all about training and development. So it's very heavy on coaching, learning, developing, training. On 3D1, this is again about, earlier we looked at barriers. So this will come into effect here. So 3D1 is assess the potential consequences of health and social care services not working in partnerships. So on here, we're just going to look at what sort of consequences can come about if a partnership working isn't done effectively, or if it just isn't getting done at all. So again, things like the barriers where we talked about finances, or you're not sure about your own role, that will come into effect here as well. So partnership working in health and social care, it brings separate organisations together so that they can share their own professional expertise and have a power sharing where they can share responsibilities. So the goals of this are to empower the orders and quality of the services provided. Like we mentioned earlier, it's just all about getting the best service for the service users. There needs to be a trust and respect between the partners. So we mentioned earlier that there wasn't much mutual respect within certain organizations, where some think that they might be a little bit better than the others. So that's not really going to give you the optimal environment for working together, is it? So there are a lot of consequences of not working together in partnership, and this can cause inefficiency in work. So some of these are lateness to duty. So if you're coming 30 minutes late, but So if you're going to start at 8 o'clock in the morning, you know your patient needs to have their medication at 8 a.m., but you're coming in at 8:30. So that happens is that patient will be given their medication half an hour late, and it'll have a knock-on effect throughout the whole day. So they'll be getting their medication late throughout the whole day, whoever is looking after them. So it can penalise their care. Poor quality of work. So because you might refuse to work together, you might not understand each other, you might just not even like each other. So that are some things that can actually conflict when you're working with different departments. So you've got concerns about funding. So you're wondering who's going to pay for these services, where do we get the money from? So there can be conflict over funding between different agencies. There's lack of funding, obviously, in a lot of cases. So where it's focusing very heavily on training and development, if you're not got the money there and you're being told you should be doing training, you should be mentored, how is that going to happen? So then communication. So again, if you've not got a good communication path between the agencies that are working together, again, that's not going to happen. You're not going to be able to work very well together. If you're using jargon that somebody else does not understand, then again, the other person is not going to know what's going on. So you need to make sure that you're communicating correctly and that the other person actually understands. And then again, lack of proper communication. This can lead to a misunderstanding. You're not sure exactly what you're meant to be doing, what are the goals that need to be achieved. So communication, again, is another consequence of not working together in an efficient way. Then just basic things like lack of clarity. You don't know what your role is. You don't know what this other person is meant to be doing. You don't know who's leading the particular situation. So you're both confused. Again, communication. If you're not communicating properly, you're getting frustrated. You're not sure about how your performance is doing, how the other person's performance is doing, or the other agency. So maybe there's a lack of care that's going to be given there. And then again, not understanding each other's professional languages and protocol. So if you don't understand the jargon, like I was saying earlier, you're going to be both confused. Other issues within this is that sometimes staff members, they're not happy with changes being made. So you could have been working in a care home for 10 odd years, and then somebody else comes in and tries to tell you to change your particular ways, or somebody who's much younger than you, or you might think, oh, they think they're better than me. And you're not going to be happy about being depreciated and saying that, why have they come in? I'm not going to listen to them. So there's a whole load of issues about who's in charge, what am I meant to do, I don't understand my role, we don't have enough time or money for this, who's actually going to go out and see the patient, is it going to be that agency or is it going to be our agency? So there's a very big consequences that can go towards the within working together. So that's it for this. Charity, I remember you said you had a question. Do you still want to ask it? Has it been answered, or would you like to ask?
Yeah, I just find out that the unhappiness is like no one is actually able to solve it, because, like in a care home,
yeah,
when you mentioned that when the community nurses come in to like alter or give some rules or just play a role anyway, I discovered that the other nurses, they are not happy.
Yes.
And most times they say, who does she think she is? Something like that.
Yeah, exactly. Because it is. I understand exactly what you're saying. That I think that is one of the major issues in general about working together with other people. It takes a really long time to actually even understand. Just understand what your new role might be, because you might be used to doing certain things in a certain way, but when somebody else comes along, and even if they're doing it in a well-meaning way and trying to improve your time, until you get used to it, it takes a lot of time for you to look at a new process or even fill out an extra form on a chart. So it does work into the issues where you don't get happy and you're like, no, I'm not happy with this job anymore. Or I don't like this person telling me what to do. So it is a very valid point.
Then another question is like, if you are new to a role and you'll be given a mentor.
Yes.
And outright, the mentor said, I can't mentor you.
Yeah, I understand. Yeah.
In such situation, do you report to the manager or you just let it be?
Well, you need to go on a request. It is your right to have the training and development. Now, that mentor would not have just been plucked out of the air. They wouldn't have just said, oh, I'm going to be your mentor, but I'm not going to be. They would have been chosen by somebody who is higher up or within the leadership to actually mentor you. But if they're turning around and they're saying that, no, I can't mentor you, now you've got two positions then. You can either just get along and do your role and fill out the mentorship forms, which is an extremely difficult thing to do and is besides the point because they're there to mentor you. So if they're not doing it, your learning and development is not being fulfilled. The second thing is you would either speak to the mentor and say that if you can't mentor me, please could you find somebody else who can? If they refuse to do so, then I would suggest that you just go to the next step above them and say that I'm having a difficult time getting that this person is having a difficult time finding time to mentor me. They're busy with this, that, and the other. Is it possible to be assigned another mentor or for them to be given a bit more free time so they can support me? So, but in general, you do need a mentor if that's been given to you, and it does need to be addressed that you're getting the right support.
Thank you very much.
You're welcome. Yeah, I've had it I'm going to I will speak to you in a second. But so I know that a few of you came a little bit later, so I'm just going to quickly scan over what we did. So we looked at learning outcome 3, which is the last learning outcome. There were 3 pass criteria, so 3.1, 3.2, 3.3, a merit and a distinction. Now, all of these are within the indicative content towards the bottom of the specification sheet. So down here, it just shows you what sort of things you need to be covering in. So multidisciplinary work, what sort of sources of practice you should be looking at. So it's always a good one to look at over here. Now, we should have had the work put back onto Moodle. So I'll just have a quick look on there. I'm going to turn the recording off.